This is Ryan Santos.
I'm Adriel Alves.
I'm Jesus Sapien.
And I'm Hugo Paredes, and this is Ulcerative Colitis.
Ulcerative colitis is an inflammatory bowel disease caused by an autoimmune disorder. This is when the body attacks its own tissue and it causes exacerbations and remissions of this disease. Exacerbations meaning that the symptoms will flare up at times, and remissions is when the symptoms are on a cool down. It mostly affects the descending colon, also known as the sigmoid colon, which is the part of the large intestine that flows into the rectum. So ulcerative colitis contains continuous ulcerations along that abdominal tissue of the colon and then all the way to the rectum. These ulcerations can produce pus, mucus, and bleed severely. Some pathophysiology on ulcerative colitis. So again, the ulcerations begin in the rectum and follow along the entire sigmoid colon, which is the part of the colon that descends on the left abdominal side. Along these continuous ulcerations, we're going to see inflammation of the tissue. Tissue will begin shedding and lesions will form. A lesion is similar to a tear or a cut in the skin. These lesions become infected and are contagious. The abdominal muscle will also become hypertrophic, meaning that it increases in size, and it only affects the inner lining of the abdominal tissue. It's not transmural, meaning that it won't affect the other layers.
So what are the risk factors for ulcerative colitis? So first, tobacco or smoking cigarettes are a big risk factor for this disease as well as other diseases. And females are also more likely to get this because it's an autoimmune disorder, and females are more likely to acquire autoimmune disorders. And the use of NSAIDs or antibiotics makes people more prone to getting this disease because both medications actually disrupt the intestinal flora, and antibiotics specifically, they kill like normal or healthy bacteria in the gut, which can cause ulcers to grow. And lastly, people that eat diets that are high in spicy foods, salty foods, or fatty foods are more likely to get this disease because foods that are high in those contents promote the growth of ulcers or can even exacerbate the signs and symptoms of ulcers. So next, the main sign and symptom for ulcerative colitis are bloody stools, and that's because in this disease there are really bloody ulcers in the intestines, and that just causes the stools to get blood in them. And people with this disorder actually also have like 10 to 20 stools per day, which is classified as severe diarrhea. And the pain that they would feel is left-sided abdominal pain, and that's because ulcerative colitis mainly affects the colon. And an important thing to look out for in these types of patients are electrolyte imbalances and weight loss, and that's because of the severe diarrhea, and they'll just be excreting out most of their fluid and electrolytes, causing many other disorders if they aren't getting proper fluids.
So some complications of ulcerative colitis is bowel perforation. Also, there is inflammation of the abdominal cavity. Patients may also experience a megacolon, bleeding, which can also lead to anemia. And oftentimes there's also dehydration. This is due to the hemorrhage or shock related to hypovolemia. Some labs and diagnostics for ulcerative colitis include a colonoscopy, endoscopy. Abdominal x-ray studies may also be performed. CT, MRI, and ultrasound studies may be used to identify any abscesses and perirectal involvement. Biopsies during these colonoscopies or endoscopies can be used to determine the histological characteristics. Fecal occult blood tests may also be done. CBC labs. These labs usually reveal low hematocrit and hemoglobin, in addition to an elevated white blood cell count. Low albumin levels may also be seen, indicating malabsorptive disorders, and electrolyte imbalances may be seen. And the C-reactive proteins from the liver are elevated due to the inflammation.
So, some nursing treatment and management for ulcerative colitis includes pharmacological therapy. This includes anti-inflammatories such as corticosteroids. There's also the nutritional management. Oftentimes, we educate patients to have smaller, more frequent meals, have a decrease in fiber intake, increase protein intake, increase fluids and calories, and avoiding milk. There's also the surgical management, such as the proctocolectomy, which is the removal of the entire colon and rectum.
Community resources. So here we have a list of community resources for anybody with ulcerative colitis. The first one, Northern California chapter. That one it was established in 1967, and it ranges all of Northern California and up the country as well. And you can find a lot of information and meet with a lot of people that have the ulcerative colitis. The Dignity Health link, that one gives you information on ulcerative colitis, and it also provides a phone number and link to find a doctor or specialist or even a primary care physician that can help you treat and care for your ulcerative colitis. Okay, so now we have a few questions that we'd like to take a quiz. Question number 1, what are some telltale signs of UC? Select all that apply. The options are bloody stools, upper right abdominal pain, rapid breathing, or left-sided abdominal pain. So the answers are bloody stool and left-sided abdominal pain. Question number 2, número dos. What is one major complication that UC can cause? Heart attack, swelling of the arms, bowel perforation, or elevated ST segment. The answer is bowel perforation. Okay? Now, the third and last question is, which of the following is an important lab study done for UC? The options are Comprehensive Metabolic Panel, CMP, Fecal Occult Blood Test, FOBT, Sputum Culture, or a liver enzymes, ALT and AST. I'll let you guys answer that question. And the answer is Fecal Occult Blood Test, FOBT. And that concludes our presentation.